to you both. Andy, since you're new to the show for the first time, let me begin with you. Would you give people just a brief thumbnail of your background in healthcare policy and how you came to be on the White House task force?
Sure, and thanks for having me on, Hugh, and it's good to be with you, Lanhee, again. I was an entrepreneur in healthcare. I started a company after my college roommate died unexpectedly, and I sold that company eventually to United Health Group, a big healthcare company, and I was, technology, data, other things. I joined the Obama administration really as an operator to lead the turnaround after the failed healthcare.gov rescue. So I'm more of a operator than I am a political hack. And then I served in running Medicare and Medicaid, and as you said, came back now when to help the effort, because I think there's some similarities in terms of kind of operating chops you need in order to get vaccinations out to more Americans.
And Andy, how big is the COVID response team in the Biden White House, and who is on it, and how does it operate?
Well, as you know, Hugh, in government, you got a lot of experts. They're everywhere. They're in, the Department of Defense, Department of Health and Human Services, et cetera. If you want to know something about a topic, there's someone who knows it. What you often don't have is a coordinating function, someone who can really connect the tissue of the different agencies and make people go fast. So the team, that's what the team in the White House is for. It's run by a guy named Jeff Zients, who is also a business person and a very good leader. We've got about 35 people, and we're doing everything from trying to procure more tests to figure out how to open schools to obviously procure and purchase more vaccines, and many other activities in between, and trying to really coordinate the agencies, the FDA, the CDC, the NIH, so that they don't operate in their little silos, but they work together to try to get this done for the public.
Lanhee Chen, people who have listened to my show for years have heard you often. You're a member of the Salem editorial board. You're a friend of mine. You teach up at Hoover. We overlook your Harvard Law School education. What is your background in healthcare policy, specifically as we go forward into the specifics of the COVID response today?
Well, Hugh, first of all, thanks for doing this. This is a great service that you're providing to the American people. I have long been involved in many of the biggest health policy debates in our country. As you noted, I'm a fellow at the Hoover Institution, but before getting here to study and really work on healthcare issues, I was a senior appointee at the U.S. Department of Health and Human Services in the administration before Andy, actually, when George W. Bush was president. I served at the Department of Health and Human Services and worked on a variety of different issues. One of the issues we worked on in the Bush administration actually was pandemic response. We had to deal, of course, at that time with a flu pandemic. And those sorts of issues were front and center during the Bush administration, in part because President George W. Bush had a keen awareness of the challenge that would be created by health pandemics. So after spending that time in government, as I noted, I've been involved in a variety of different efforts on the policy and political side that have been focused on improving the American healthcare system. And as you said, for the last couple of years, I've been here at the Hoover Institution at Stanford University, where most of my work focuses on the American healthcare system. And so the last couple of years have been doing that. And then over the course of the last year have been involved in advising states and the federal government on how we can respond and react to the COVID-19 crisis. And it's really been a remarkable challenge for our country, but one that I'm hopeful actually now that we can beat back here in the next couple months. It's going to be a tremendous accomplishment for us all, but it's going to require us to work together.
And as people who listen to the radio show know, but maybe not those who listen to this podcast and this YouTube presentation, from the first story in Wuhan, I have been pounding this drum about awareness of the threat because I read The Great Influenza when George Bush carried it around back in the days when Lanhee was there. I've always been aware of the threat. And I have a brother who's a research toxicologist who has warned me forever about this. And so now we're living the nightmare, and early warnings such as those that I gave and others gave went unheeded. And unfortunately, we are where we are. Where we are is 65,972,000 doses of vaccine delivered, 44,769 doses administered, and 33,783,000 doses received twice, or people have twice in the United States. Andy Slavitt, where are we, do you think, in percentage terms of the effort? Not in terms of the number of people, we can do the calculation against 330 million, but in percentage terms of the cycle to get the vaccine to everyone who will take it.
Yeah, well, faster, but not fast enough. I'd say, over the last 3 weeks, we've increased vaccination deliveries to states by about 30%. We've also, as of today, opened the retail pharmacy program where we're shipping directly to retail pharmacies. FEMA is standing up 100 community health centers. We found more vaccinators. But all of that is to say that there's still way more demand than there is supply of vaccine. There probably will be for the next several weeks and maybe even a bit longer. So we're working with the two manufacturers to get even more doses created. I think they would tell you that they're in a place, this is Pfizer and Moderna, where they've got their manufacturing figured out. There are still some bottlenecks. This is not like producing shoes. This is not a kind of just mass production. This is, taking, biological substances and very sensitive liquids and then putting them in vials and so forth, which is a lot, as I learn every day, there's a real science to it. And then we've got another vaccine potentially to be approved by the FDA around the corner, hopefully. I think that may be the end of February or early January, knock on wood. And then I think you're going to start to see things really accelerate. My sense is, without predicting the future, that March will show really significant gains every week over week, until such time as we get into the spring and most Americans who want shots, the vaccine, should hopefully be able to get it.
Now, Andy, in Israel, which is ahead of us in terms of their distribution grid, they have now experienced a situation where they have more supply than daily demand, which is a great situation to both be in and a perilous situation because not enough people are lining up. When do you expect, best guess, obviously we can't hold you, to be in that situation where everyone who wants a vaccine can find and access a vaccine? Do you think it's actually April, May?
Yeah, so this is a completely unauthorized prediction since I'm not, there's too many factors to predict, but I think that's about right. Look, it's a state-by-state decision on when they allow different groups in, and the states are getting better at doing this. I think my sense is that many or most of them will be opening up, in the spring, late spring, to all Americans who want a vaccine so they can get one. And I'll tell you, we're already beginning to deal with, even as you deal with the supply problems, we are also beginning to deal with the conversations that we need to have with people who are pretty sure they want to take the vaccine but have questions or may not be so sure. And that happens in different pockets and different communities, so it's not evenly across the board.
That's going to be my second topic to close out the first one. I want to get Lanhee's estimate of when we cross that available supply and people in line demand point as Israel has done. Are you as optimistic as Andy is, maybe April, maybe May, when there will be a vaccine for everyone who wants it?
Yeah, I think, Hugh, that's right. I mean, my sense is that right now the situation is improving on a day-to-day basis. And the addition, Andy mentioned we're probably going to have a third vaccine here from Johnson & Johnson and Janssen Pharmaceuticals available here, hopefully within a matter of a few weeks. And I think that's also going to help because that particular vaccine only requires one dose as opposed to the two-dose formulations we have that are available now. So I think that's going to help a lot. And I do think, I am hopeful by the time we get to the late spring, we will be able to have a lot of supply available, plentiful supply, hopefully, for people who do want the vaccine. And that is really going to be the key to getting us out of this pandemic. Absolutely.
All right, now let's turn to the second biggest issue. Supply is the first issue because you can't ask the second question until you've got a supply. Let's talk about safety. Andy Slavitt, what is your estimate of the safety of the vaccine?
Well, so I've spent a fair amount of time talking to the FDA folks and the CDC folks, and gratefully, the instances of an adverse event are both extremely rare and have always, so far, at least, only been temporary. I think it's the job of the FDA to report each of these events, to investigate them, and to be very public about them and to try to understand them. But as one of the Peter Marks, who is one of the career leaders inside the FDA, has said, these vaccines really are miracles. You almost never see vaccines that have this level of efficacy and this level of safety. In the history of vaccination, almost, I think the number is something like 90+%, Lanhee might know it, of adverse events occur within the first 2 months. So some people criticized the FDA at the time for taking a little bit longer to make sure that the 2 months pass. Than Johnson, they're doing the same thing. But I think that gives me a lot of comfort and gives a lot of people a lot of comfort. And of course, now that you've got 40 some, close to 50 million shots in people's arms, and we've witnessed very, very few allergic reactions. And again, those have been temporary. So the news is great, and we got to continue to talk about it.
Lanhee, what's your assessment on the Republican side of the vaccine? Again, this is science. There's not really a Democratic or Republican side, and the official toxicologist of the Hugh Hewitt show says, take the damn thing as soon as you can. But what do you think?
Yeah, look, I think we've got a tremendous amount of data and evidence available for both of these vaccines. And when Johnson & Johnson hopefully comes online, we'll have a lot of data for that as well. And so I think it's important for people to realize that both Moderna and Pfizer, both of the vaccines that are available now, went through clinical trial processes that were very rigorous. In the last phase of those clinical trials, you're talking about tens of thousands of people. And now we have more than that. We've actually got real world evidence, for the millions of people that have gotten vaccinated. So we've been able to see. I do think it's the case that people recognize a couple things. First of all, these vaccines are incredibly protective. The levels at which they are protective against COVID-19 is truly remarkable. It's a testament, Hugh, to science. It's also a testament to government and the private sector having worked together over the course of the last several months. And in fact, over the course of the last year, this vaccine development process has been going on for a long time. And factors working together to really bring these vaccines to market, to test them, to ensure their efficacy, which, as I said, in the case of Moderna and Pfizer, is over 90%. It's really a remarkable accomplishment. And the other thing I'll just say is that it is the case that both of these vaccines are effective. It is the case that folks have been taking them effectively, and we're not seeing the kinds of severe adverse reactions that personally I'd be worried about. And I think that's something for people to know.
And Andy, I want to go back to something you said. I believe it would be very important for any adverse reaction that resulted in death to be publicized and put into context and put against the number of 44,769 doses delivered. But we don't have one yet that's been fully investigated. I know there's been a case, a couple of suspicious ones. Does the Biden administration agree that every adverse morbid event has to be publicized and talked about?
Yes, absolutely. And we began Monday, Wednesday, Friday public briefings where we take open questions from the press. We have the head of the CDC and the head of the NIAID, Dr. Fauci, on, and they take any question that comes their way. And what the head of the CDC, Dr. Walensky, has said is that she's committed to me that she will address every issue with regarding any adverse event. Because the things that get in the way sometimes are rumors. Sometimes those rumors are started innocently, or people have some fear. And so the best defense against that is having just a candid dialogue. I would say one thing, if you don't mind, I would say one quick thing to pick up on what Lanhee said. I hope that when this story is written, this will be a great American success story, begun in one administration, completed in the next administration. Amazing innovation out of American scientists in the private sector, aided by smart thinking from the public sector, something that everybody can take credit for, put their hands in and say they had a hand in this success, including, by the way, all the Americans out there who have been struggling through this whole crisis. So, this has been a very challenging year. This can end on a very positive note with, I think, something that everybody has a chance to feel good about.
I agree, if we get people to take the vaccine. And I'm going to get to that part in a second, but a quick technical question, Andy. Will AstraZeneca, the Oxford vaccine that has been developed in the UK and is being widely used in Europe, be made available in the United States, or are we dividing up the world? And when do you expect Johnson and Johnson to come online? And will it be, in your view, as efficacious as the Pfizer and Moderna vaccines? Lot there, so I'll let you unpack it as you'd like.
Let me take it in order of chronology. Johnson and Johnson is going to be. They've submitted an emergency use authorization. People are poring over the data right now. They're meeting at the end of February, and they'll make a decision. And if it goes our way, knock on wood, we could be at the very end of February, very beginning of March, in a situation where we have a third vaccine that, as Lanhee said, has a single dose requirement, doesn't have all of the different cold chain requirements. Now, that vaccine, as people have, I think, seen, the headline number relative to Moderna and Pfizer is that it has a lower efficacy rate, so in the 70s in the U.S. versus in the 90s. But I think what's important to realize, we may have done ourselves a disservice by focusing so much on the incredible success of the Moderna and Pfizer, is that when you look at not the success rate of the vaccine, but the success rate of the vaccine against severe disease, basically meaning something that would require a hospitalization or a death, there were no deaths or hospitalizations in the Johnson & Johnson vaccine. So if I were offered the Johnson & Johnson vaccine, I would feel the exact same way about it as if I were offered the Pfizer and Moderna vaccine. I don't mind dealing with a cold. I don't think most of us are too concerned about COVID-19 if it results in some mild symptoms. What we are concerned about is dying and going to the hospital and being on a ventilator and all of those unpleasant things. And under that score, the Johnson & Johnson vaccine data so far has been very strong. But we will see. There's more data there, and we will see what the FDA says. I don't want to get ahead of them. We'll let them do their jobs and come out with whatever they have to say about it. In terms of AstraZeneca, that's behind Johnson & Johnson by a few months. I don't know the outcome of that. I will say that it will be probably, my understanding is, later in the spring before they even submit an EUA. We have gone ahead, though, before this. This is important for the audience to know. And we have procured enough vaccines for every adult American, even before taking into account the Johnson & Johnson or the AstraZeneca or any other vaccine. And the reason is we want to be prepared for every situation and every contingency. And if something happens with the data and Johnson & Johnson's delayed, we want to be sure that we have enough vaccines to vaccinate the public, and we do.
So, Lanhee, I now want to turn to you as an international healthcare policy expert. Obviously, with 400 affiliates across the United States, I mostly have Americans listening, but millions of those Americans have family around the world, right? They're worried about Mexico. They're worried about Europe. They're worried about Australia and Japan. They're worried about China. When does American capacity and European capacity begin to make a sizable dent in the world population about which we are genuinely concerned?
Yeah, Hugh, this is a really good question. I mean, the challenge we have is that this is truly a global pandemic. It's not an American problem. It's not a European problem. We're seeing the incidence of COVID-19 all over the world, and it is going to require some cooperation between countries. Each individual regulatory authority is responsible for clearing this vaccine in their own way. And different countries have different vaccines they're working with. As you noted, the AstraZeneca Oxford vaccine is very common in Europe. It is also common in other parts of the world as well. There's a vaccine, there's actually 3 vaccines that have been developed by China with various efficacies. The Russians have their own vaccine. There are a series of, in India, there's a vaccine as well. So in order to defeat this pandemic, it is going to require different countries to come together and recognize the value of promoting vaccines, vaccinations to try to inoculate against this disease. I want to come back to something Andy said, though, which is really important. And that is that the purpose of these vaccines is not necessarily, and I mean this globally, not necessarily just to avoid COVID-19 entirely. It's to avoid the variability that comes with COVID-19. In other words, people that are, otherwise relatively healthy, showing up with very, very severe symptoms in the hospital, or God forbid, in some cases, actually dying from this. That's what we're trying to avoid. And the vaccines that I've seen here in the United States, certainly, but also abroad as well, the clinical evidence that we're seeing so far is that they can be pretty effective at avoiding those outcomes. And that's really what we're trying to do, not just here in the US, but around the world.
All right, let me begin to go down a couple of the quick questions that I get all the time. And I try as a journalist to stay on top of this, but you two are the experts. Andy, should people who are eligible for the vaccine, who have in fact already had the virus, receive the vaccine?
Yes. Yes, absolutely. They should. I know people who have had the virus and they have had the vaccine. We know a little bit more about how the immunity works with the vaccine than we do when people acquire it naturally. We know there's something that people refer to as waning immunity, which means that over time that immunity profile changes. So absolutely, I say yes.
So my producer who has had COVID and was pretty sick, not in the hospital, but pretty sick, how long should he wait to get his vaccine was if he becomes eligible for it? He's too young right now. Is there a period of time which the government is recommending you wait after you recover to go and get the vaccine?
That's a good. If he's done with his symptoms, then I believe he's absolutely in the clear to be able to do that. And God willing, if he's young, by the time he gets.
Oh, he's not young. He's as old as almost as old as I am. He's ancient. Let me go on to the underlying condition question, which I get a lot, and I don't know the answer. If people have underlying conditions like high blood pressure, heart disease, or morbid obesity, should they get the vaccine, Andy?
Well, even more so, because some of those conditions put you at higher risk for having for having a serious complication if you get COVID. And of course, as you said earlier, 46 million plus Americans, or 45 million plus Americans as of yesterday evening, have gotten the vaccine. Many of them older and with heart conditions and things like that. Many of them in nursing homes with multiple conditions, and that's been absolutely fine. I think what we will see, and I'm speaking very specifically to Pfizer and Moderna, that determination, should Johnson & Johnson be approved, will be separately determined when that one comes out.
All right. Now, are vaccines free? If people are out of money, and many people are, and they don't have health insurance, can they get the vaccine?
Absolutely. Free. There's behind the scenes, an administration fee is paid by the government to the people who administer the vaccine. So we pay for the labor. People don't have to worry about that. And the vaccine itself, the substance, was already purchased thanks to Congress for the public.
Last in a sequence, how long will the immunity gained by either Pfizer or Moderna last?
We don't know, and we can't know. So we have to be very honest and not sugarcoat answers. We don't know, and it probably doesn't make sense to speculate. I have heard people speculate everything from. I think one of the CEOs of the pharmaceutical company said they think it'll be every year. I've heard some say it could be less frequently than that. And this depends on these new variants and how quickly they progress in some parts.
I'm coming to the variant shortly, but Lanhee, I went through a lot of questions there with Andy. Do you have any comments on what he had to say?
No, I think Andy addressed all of those. The one point I want to underscore is that people who do have pre-existing conditions, such as diabetes, such as heart disease, that might make them more at risk for adverse outcomes because of COVID-19, it is particularly important for them to have the vaccine. And in fact, all the data we have so far suggests that's a very, very important thing to do to prevent the onset of severe COVID-19. These vaccines can do that. They can help ensure that doesn't happen. They can't guarantee it, obviously. We can't guarantee anything in life, but certainly they can help folks. And I think it's important for folks in those situations to really get this vaccine as soon as they're able.
So, Andy, how does an 18-year-old, say, with juvenile diabetes get proof that will allow them to get into line and get an appointment when most of the computer programs I have seen, and I am 64 and 3 weeks, so I'm following this pretty closely. You can't get in unless you're 65. How do they get permission to get a vaccine?
So one of the things I'd point to is that every state has a different list of who is eligible for a vaccine right now. and there are probably, estimating 8 to 10 states where someone who is younger but has a pre-existing condition qualifies. In other states, some states it's based strictly on age, and some it's based on job type, first responders, in some cases teachers, and others. So it's a really potpourri. If you want to find out in your state, I think you can go to the Kaiser Family Foundation website, which has a list of who's eligible in each state. And then, each state is requiring underneath that making their own rules for how people would demonstrate that. Is it the honor system? Is it a note from the doctor, or so forth? So my advice is either check your own state website, check this Kaiser Family Foundation website.
So, Lanhee, I know you have children, so I want to put the next question to you. Israel has begun to vaccinate to the age of 16. What is your understanding of children and vaccines right now, not including any variants that have not yet been understood and studied?
Yeah, I mean, currently the vaccines are not indicated. In other words, the FDA has not approved their usage for, in one case under the age of 16, in the other case under the age of 18, in terms of Pfizer and Moderna. So at this point, kids, do not have access to the vaccine, and in fact are not taking the vaccine. That may change as we go on, as I understand it, and Andy probably knows better about this. But both manufacturers, I think, are engaging in the clinical trial process to ensure the efficacy and safety of the vaccines for those under the age of 16 or 18, respectively. And I think it's important we let that process play out. Right now, the focus of these vaccines is the adult population, and in particular, ensuring that older Americans, those, as Andy noted, in various states that are able to get the vaccine, are getting it and are getting access to it. That is the focus right now.
Now, Andy Slavitt of the White House COVID Task Force, I have read, and you can tell me if I am wrong, that the resistance to the vaccine is greatest among two groups: rural Americans and African Americans. And I don't know why that is. I don't need to speculate about that. But if that is correct, how will you address it? And if it's not correct, feel free to tell me I'm wrong.
Sure. So it's interesting. The closer I get into this, the more I struggle with even the word resistance. And what I really think we have is people who have very legitimate questions that they want answered before they take the vaccine. Of course, there are some people who are just not supportive of vaccines under any circumstances, any vaccine. That turns out to be a relatively small number. In the case of COVID-19, I think you have people who would crawl over broken glass to get the vaccine. Maybe the three of us are in that category. And then I think you have some people who are in the category of saying, hey, maybe I don't know if I want to go first, or I have a couple of legitimate questions I have to get answered. Those do tend to be different in different communities. I think the two you identified probably both have slightly larger sets of groups that have those types of questions, although, those are the questions that probably everybody has. It's interesting the way the human mind works. I think it is possible to have two thoughts in your brain at the same time, one being, hey, why can't I get my vaccine earlier? And the second being, hey, I've got some questions about this vaccine. So that's very legitimate, very reasonable, and I think to be expected. And we have to just do a good job of having a conversation and a dialogue, getting people's questions answered, pointing them to reliable resources, not allowing Twitter or TikTok or Facebook somewhere to give people unreliable answers to their questions. And I think, which is why I'm very grateful you're having Lanhee and I on the show today, because I think getting the people authoritative, actual facts is really, really important.
Well, then let's move to herd immunity, because there are many people who wonder what it is, when it will be achieved, and how long it will last. So I'll let you swing at that, Andy Slavitt. What's your understanding on that question?
I think I'm going to take a pitch here because, and I'll tell you why. What I can tell you is how much supply we'll have, and I can estimate, as we've tried to do, how quickly we'll have that supply. And there the story is getting better, never fast enough, but getting better. What I can't estimate are two things. One is exactly how many people will take the vaccine and how quickly. So if, in fact, we have enough supply, but only, say, half the people in the country take it, that would make it very hard to predict. I also can't predict how well how much the variants are going to be spreading and how well and how quickly the vaccine will work against every possible variant. I think we know some of the answers to that, but when you put all of that together, it is very perilous to predict when we will be at herd immunity, other than to say as soon as damn possible.
No, Andy and Lanhee, the one time I've interviewed Dr. Fauci on the show, I asked him a question, it was back in February, that the 1918 virus iterated 12 times over the summer of 1918 and emerged deadlier. What was he seeing? He said, that's a great question. We don't know. And so that was early on. Do we know about these variants in any sort of way that alarms you, Andy, beyond the ordinary alarm that would arrive with any virus? And in specific terms, is there anything that alarms you about children? Because if it turns towards children, the world changes in a heartbeat.
Well, so yeah, my job is probably to be in a state of alarm and playing through bad scenarios and trying to plan for those scenarios, even hoping many of them don't come to fruition. I think these variants are not good news. I think these variants suggest that there is enough multiplication of this virus out here that the virus is going to go through this evolutionary path more quickly than we had hoped to try to resist where it can. Now, the good news is that the major variant, the one coming out of England, the UK, the one they call B117, the vaccine and human immunity seems to hold up very well against that. There are other mutations where there's been more than one mutation to the spike protein, as has happened in South Africa, and has happened in Brazil, where the vaccine is still effective but less effective, and where there's some evidence that pre-existing immunity doesn't work and doesn't hold. So these are signs that we are going to be, like with the flu, facing something that will continue to change on us. Most of these changes are completely harmless and completely irrelevant. Most of these changes, and this virus has been evolving this whole time in front of our eyes, have had no real impact. But occasionally they do. And that just means our science needs to be better. And one thing I can tell you from being in here is I am a lot less scared the more I see what our science can do. I talk to the pharmaceutical companies multiple times a week about this very thing. And, I am so grateful to say that they're on top of it. They are already working on how to address these mutations. And, there will be an ongoing battle here. And that's what we know today. We will know a lot more in a year than we know right now, but we know more than we did a year ago for sure.
Now, Lonnie, this is a political question, so I don't want to put Andy on the spot as a member of the administration. But we have learned today from reporting in the Financial Times that cases of the virus may have appeared up to 8 weeks earlier than had previously been disclosed by the Chinese Communist Party. Do you have any confidence at all that they have learned to disclose variants if they arise in the PRC, and that around the world everyone will be in disclosure mode immediately on variants?
I do believe they'll be in disclosure mode. The question of how quickly they disclose it is in my mind, an open one. I have grave concerns about how the Chinese government, how the Chinese Communist Party handled the start of this pandemic. I know that there is an investigation that's been underway that the World Health Organization has led. That's not an investigation that I personally have great faith in, because I don't believe that the Chinese government has been forthcoming. So I'm hopeful that they understand that this is a serious pandemic, that it's important that the world know what they know as soon as possible, because that is the key to us fighting, additional mutations, as Andy noted of this, is that people are forthcoming and that we're able to have science respond to these things. It is in not only their interest, but the interest of the rest of the world. But I think it's deeply disappointing and concerning how the Chinese government handled this at the outset, and the way in which the World Health Organization did not play a constructive role, at least early on. Those are things I personally am very worried about, and that I hope the message has been delivered. I hope that the president delivers that message to the Chinese, that it's incredibly important for them to work together with the rest of the world on this, because it's not just about their fates, it's the fates of us all. And if they're not able to do that, then, we're going to have a problem.
Now, Andy, I want to go back to the issue of comorbidities, and here social media has done a great disservice because I've tried to follow it as closely as possible, and I see lots of misleading data on comorbidities, lots of accusations that the death toll is inflated. And I don't think it's a particularly relevant statistic because I know people myself who have died from COVID and have had no comorbidities, and I know people who've died with comorbidities. Death is death. But what is your understanding? Can you shine some light on the idea of COVID doesn't hurt you unless you have a pre-existing condition? I don't believe that's true, but what is the government's position on your understanding on that question?
Yeah. So here's what we know. We know that if you're older, you're at higher risk. We know that if you have a comorbidity, an underlying condition like diabetes, like high blood pressure, that you are at higher risk. We know that if you're male, you're at slightly higher risk. We also know, oddly, that if you're young and extremely healthy, you're in a different kind of risk. I have a 19-year-old who is an athlete and who is in far better shape than his dad ever had been in his life. And he got COVID and has had a very, very tough time with it. This was months ago, and he still hasn't entirely back to himself. And there's something strange that goes on with people who have really good immune systems and are really good shape and are younger. He's not the only one. We've learned unfortunately a lot more about this. People who have high exposure, who are in job types. I mean, this is very much of an occupational disease. If you are working in a meatpacking plant, if you're living in a communal setting, if you're working in a grocery store, you are much higher. You're at much higher risk. If you're working in farm labor group, so there are things that make you much more exposed, which is why people are advised, wear masks, try to avoid large crowds, et cetera. You'll lower your risk. But of course, if you look at the tables, as you get older and older, or as you get sicker and sicker, or as your job type gets you more and more exposed, you are indeed at higher risk. And so the final point I want to make here is, even if you personally don't feel like you're at high risk, you are at high risk of being a spreader, because when there's community spread, eventually these things work their way into nursing homes and communal settings, et cetera. So you may personally not feel at risk, but maybe someone you know becomes at risk because of you, and very likely someone you don't know could end up being at risk because you've been part of the chain of spreading it.
Now, Andy, let me stay on that for a second. The world's greatest defensive end in the NFL, Myles Garrett, got COVID in the middle of the season. And while he returned after 2 games missed or 3 games missed, he freely admitted he never got back to his all-pro form before that. It lasted, like your son. It lasted. What is the understanding right now, or does science simply not yet know the consequences of COVID long term? Because if it doesn't, that's another great spur to get the vaccine, because you really don't want to be part of that test cohort.
Yeah, unfortunately, we don't know, and it's a question that people who are dealing with and still dealing with this bout face, and are quite loud and vocal, as they should be, about trying to get answers. In many cities around the country, they're opening up these COVID treatment centers for people who have had long-term conditions. In some part, they're trying to find commonality, things that work. In some part, they're trying to learn and get as much data as possible. But it's a mystery, and these viruses, as we know from SARS and MERS, et cetera, they can kind of hide out in your body in different places and lay dormant and continue to rear up. These viruses are not super straightforward. They're not. It's not and it's also not common sense how your immune system responds. Your immune system doesn't, isn't. It's an amazing thing, but it isn't highly predictable in terms of how it reacts to these viruses. And in some cases, it overreacts, and in some cases, it can get fooled. We really need to unpack this mystery. And to your point about the vaccine, I not only do I not want to die, I don't want to be long-term sick either.
Now, Lanhee, I want to go to the idea of 100-year events, because I don't want people to develop a false sense of security about this. This is a 100-year event, but having done land use forever, that doesn't mean another one can't happen next year. It just means over the course of 200 years, you'll get 2 events, and they could be back to back. What do you think, since we've had SARS and MERS and now COVID and H1N1, what is going on and how the world to prepare to do this more frequently than we have done it any time in human history.
Well, Hugh, let's start with the good news first. The good news is that the more we encounter these kind of respiratory diseases, the better able we are to respond and react. And by the way, to see the first signs of a problem. There's been a lot of conversation about how some countries in Asia have handled the pandemic very well. South Korea has been discussed, Taiwan has been discussed. Part of the reason why they were able to do better is because they had firsthand experience with SARS, which was the severe acute respiratory syndrome, sort of the cousin, if you will, of COVID-19. They saw that pandemic go through Asia several years ago, and so they had the opportunity to use that time to see what they needed to do to prepare, to see, for example, the value and importance of social distancing policies when the virus is first spreading, to see the value and importance of masking, to understand some of the science behind this. So, in that sense, even though this has been an awful last year for the pandemic here in the US, we have this experience now, and that experience is tremendously helpful as we go forward and deal with further, particularly respiratory style pandemics. But the reality is, you're right, Hugh, which is that things in the natural world are happening that we don't have control over. And so it is entirely possible. In fact, the data tells us it's likely that we're going to see another pandemic at some point over the course of whatever period of time it is. And so it's important for us to do a couple of things. First of all, to ensure that we're investing in the right technologies, to ensure that we're investing in what we need to have a public health infrastructure that allows us to respond to these kinds of things. And when we can, to cooperate with other countries to make sure that we are working together to identify these things as they first happen so that we can respond to them effectively and well, because an early response and an aggressive response is going to be the best way to deal with these future pandemics.
Now, I also know from the data that podcasts run out of time between 45 and 60 minutes. People stop listening. So I want to get to one more question and then ask you both to reiterate the key points. My last question, a public policy question, Andy. I spent last week on Skid Row in downtown Los Angeles, which has the highest concentration of homeless people in the United States. It's an absolutely devastated area. I was double masked, I was gloved, I was as careful as I could, but I still thought I was sitting in the middle of a petri dish of virus because there was a federal court hearing that I had to attend. The homeless seem to me to be a particularly vulnerable community. Does your task force have anything in mind for them?
Well, Hugh, this is a very astute question. Although I think to the premise of your question, my understanding is that Hugh listeners would listen all day long if you ran the podcast all day long. So you may have to test that sometime. But maybe not with me as a guest. Yes, the answer is yes. We are opening up special centers and mobile vaccination capabilities as our states that we are helping to fund in these communities, focused on a couple of really targeted groups. You mentioned one, which is the homeless, but also farm labor camps, really problematic. Other congregate settings where people are just forced to live in close quarters. We forget about those, but there's many people who are living in those kinds of situations. They are at very high risk, and so this is part of our more places and more mobile and bring vaccines to people, because you can't expect everybody to be able to make their way to Yankee Stadium or where have you.
So Andy, in your before we go closing statement, is it completely apolitical? I think the most important thing is that everyone believe everything is apolitical. That is my belief. I think the scientists, because I've got scientists in the family, are doing the best they can as fast as they can with a virus that has never been dealt with before, with the best intention. I think every governor is doing the best that they can, though some have made mistakes and some have made wise decisions. I actually think everyone's trying to do the best they can. Is that your understanding?
Yes. So look, I am a Democrat, although as I said earlier, I'm not extremely political. And the first week into the Trump administration's response, I called the White House, spoke to Jared Kushner. Lanhee and I spoke pretty frequently. We got in front of the Congress to answer questions as someone who comes from on the left side and the right side. of the political aisle. And, you're hearing very little difference in terms of what Lanhee and I are saying here, which doesn't mean that we agree on every topic. It just means that when it comes to saving lives, it's a no-brainer. And we all ought to separate some of the things that we put into our own identity, who we are, how we describe ourselves, from the basic fundamental work that we have to do to say, hey, let's come together and beat this thing. Let's all take credit for it. Let's all suffer as we are when it's not working. We can be proud coming out of this moment. And I do think that while we try to put a political lens on many things, this is one that hopefully should escape that definition.
So, Lanhee, I want to go to you for the penultimate statement. What is your general view of the situation? What is the most important piece of advice? I think it's get the vaccine, but I'll let Lanhee speak for Lanhee.
Well, I think it's been obviously a difficult last year, but as I look ahead, I am optimistic. I'm optimistic that we can beat back this pandemic, that we can do it together. This should not be a partisan issue, Hugh. I know so much in our politics, so much in our policy landscape has become polarized, but this is an area where we really can work together. And we do have the opportunity now with science, with us working together. If enough Americans can get this vaccine, we can beat this thing back. And I think it's crucially important for us now to be focused on doing what we can. And I think it's also important for us not to let down our guard at this point. It is tempting because there are vaccines out there, because people are getting vaccinated, because we are seeing immunity conferred because of it. There's a tendency to kind of let your guard slip. And I would just say this is not the time to do that. This is the time when we need to be focused as a people to come together to get past this thing. And that means continuing to do everything we've been asked to do for the last year. And I know it's a lot. I know it's a lot for many families out there that have been suffering through this, that have had to deal with this in their own way. But, we can come together and deal with this thing. Get the vaccine if it's available to you. If not, continue to do the things you need to do, and it'll be there. And the day will come when we'll all be able to be together again and do the things that we enjoy doing together.
And Andy, last word to you.
It's been a really dark kind of period. And for the first time in a while, thanks to the efforts of lots of people, we're starting to see some rays of sunshine potentially poke through. But if we've learned anything, it's that this virus is unpredictable and will likely still have more surprises in store for us. So I would underscore Lanhee's point, let's not declare victory early, and let's all recognize that we can do our part. There's something each of us can do. Obviously, taking the vaccine, I'm a big proponent of wearing a mask, but also just in general, the opportunity to help others who are hurting is incredibly high right now. There's more opportunity to help people who are either having a mental health crisis or have lost their job or are in some other bit of despair or need some groceries delivered. And I think when this is all over, we're going to look back and say, wow, so many people did so many extraordinary things. And I know I'm going to kick myself every time I had an opportunity to be helpful to somebody and wasn't. So I'm going to spend the next whatever period of time it's going to take getting there, trying to do that, not just in a governmental way, because I'm here for a brief period to help out, but just in a personal way, just recognizing the need and the pain out there and trying to do something about it. And I know so many Americans are, and it's inspiring.
Andy Slavitt on the White House COVID-19 response team, Lanhee Chen at Hoover. I want to thank you both for doing this. Come back in a couple of weeks or a month and let's do another update, and hopefully the news will continue to get better. And in the meantime, anyone who is listening, go onto your computer, make the phone calls, go get the vaccine. Don't get bored. Don't get dismayed at the fact that there's a line. Just be as steady because your life depends on it. Thank you for listening. Thanks, Andy and Lanhee. I'll talk to you on the next Hugh Hewitt.